If you're looking for Botox treatment for bruxism in Hawaii, watch this short video. Are you experiencing any of the following? Worn tooth enamel, increased teeth sensitivity, flattened, fractured, or loose teeth, tired or tight jaw muscles, indentations on your tongue, or receding gums? If so, bruxism may be the cause. Left untreated, bruxism will affect you not only functionally, but aesthetically as well. Typically, a mouth guard is used, but that only protects your teeth from wearing down. If your clenching is strong enough, your teeth will continue to move, thus eroding your gums, exposing your roots, and causing tooth sensitivity, among other things. Therefore, the clenching must stop. An effective way is through Botox injections. What it does is relax the large jaw muscle enough to stop the involuntary clenching. This significantly reduces the grinding and clenching, thus stopping the ill effects of bruxism. Damage to the TMJ and headache should be reduced or eliminated as well. Patients that received Botox therapy have reduced the size of their large jaw muscles due to reduced or elimination of clenching. They have also reported having more dreams since now they are able to reach REM sleep. If you're looking for Botox treatment for bruxism in Hawaii, call Dr. Russell Masunaga at 848-8880 for more information on Botox therapy, or to make an appointment to discuss your dental health. Dr. Masunaga is a UCLA-trained dentist, a former president of the Hawaii Dental Association, co-founder of the Dental Samaritans, host of the dental show Tooth Talk for over 20 years, and schooled and trained by the American Academy of Facial Aesthetics to practice Botox therapy. Again, if you're looking for Botox treatment for bruxism in Hawaii, also known as teeth grinding, call 848-8880 now, or visit www.myhawaiidentist.com.